you have not seen folks at CPRC. Okay. I'm gonna pull up. So actually, let's look at the scan from June. Okay. And I'm gonna go in excruciating detail what all the anatomy is. And I think, because that scan, when you first presented, didn't show anything to suggest metastatic. So tumor. So here's the aorta. Okay, that's the big artery that feeds the entire body. And here's the vena cava. Left-sided tumors have a tendency to spread to this area, okay? And particularly in this area here, where you can see the kidney kind of behind the bowels, that's called the para-aortic region, okay? And this here, this is from June. It looks beautiful. It's crystal clear. All right. I'm going to show you the most recent one. You can see. You see that area over there? So that's not normal. That's not normal. Okay. Your tumor markers are fine. Okay. The reason I came in and I thought, because I know Dr. Bosler had mentioned about presenting your case.
I missed that appointment
at the tumor board, and I was expecting you actually sooner than today.
Yeah.
Okay. Well, we have this. The next step, and actually your case, I remember when your case was discussed at our tumor board, what to do. Do we proceed, because we need to address this. Do we proceed with surgery? Do we proceed?
Yeah, because I think at that time nothing was coming up in the markers.
Right, right. Well, most of your tumor is what we call teratoma, based on the initial pathology, okay? So there's a problem, and testis cancer, when it's non-seminoma, there's two categories, seminoma, non-seminoma, okay? And they behave differently. Non-seminoma has several components that they can all be combined. Embryonal cell, teratoma, yolk sac, it's a whole variety, but they tend to be combined. You have mostly a teratomatous tumor in the testicle. So there is a good possibility that some component of this thing could be teratoma. And why am I focusing on teratoma? Because of all the testis cancers, teratoma doesn't really respond to chemotherapy. Okay. However, non-seminomatous tumors, even if they have a large component of teratoma, they could have some of the other components. So let's say you have a pure teratoma in the testicle, you could have non-teratoma develop somewhere else. Okay? So when we talked about when Dr. Bosler presented your case to the board, the general consensus was to go ahead and proceed up front with chemo. Okay? And why? Because again, given the possibility that some of this could be non-teratoma, the other embryonal or whatever, those things just melt away with chemo. They truly do. I mean, I have seen patients with really bulky masses. You give them chemo and they...
Is that right there? Is that like a solid mass or what?
Yeah, that's a solid mass.
How big is that thing?
Let me just see what they, so the kidney, a normal kidney from here to here on average is about 12 centimeters. So this thing is at least 10 centimeters. So from June to now,
and it's probably gotten bigger now because that's been a while.
Yeah, it's been a month. It grows big, but so.
Yeah, because he's been having a lot of pain.
I've been having pains, and I've been having...
Since before they called it.
And
they called it, on its greatest dimension, 7.4 centimeters. So from top to bottom. So what we had talked about in the tumor board, the panel recommendation was for you to see medical oncology.
Mm-hmm.
Okay? And actually what I'm going to do is I'm going to get on the phone and I'm going to call the medical oncologist, because I was expecting you before and I don't want your appointment to be put off. I'm going to say, he's here, I got a captive audience, I want him seen. So if you give me a few minutes, okay, I'm going to get on the phone and call them. Alrighty?
Okay.
But what we had talked about was for you to get chemo up front with a short follow-up repeat CT scan to see if you're responding to chemotherapy. Okay? Because if you're responding to chemotherapy, you wanna get the full treatment. Okay? So that's what we got.
Okay.
And again, I'm really sorry. I thought you knew all this.
Mm-hmm. No,
I really did. Otherwise,
I didn't know anything.
Okay.
I just know the doctor called me and
Yeah.
told me that I need to come in and he needs to talk to me, and in that appointment I missed.
Yeah.
Because I had two things going on at the same
Yeah.
time that day, and I thought that it would just be easier just to reschedule this one or the other one.
Yeah. All right.
So
It's okay. If God told me I had to have cancer,
mm-hmm.
if I was, you have to have cancer, knowing what I know about cancers, this is what testis cancer is what I would probably pick, because it's pretty much one of the most curable cancers there is.
Yeah.
It does take work. There's a good chance you will need both chemo and follow-up surgery. Okay. A node dissection, that's a big surgery.
Yeah.
We're not ready there yet.
Okay.
We're not there yet. But I look at patients with testis cancer and say we can cure this. Okay. But if you give me just a minute, okay. I'm gonna call medical oncology. Okay. And 1 second.